Thank you. COVID-19 Conversations are brought to you by the African Alliance with support from the South African Medical Research Council and the Department of Science and Innovation and the Vaccine Advocacy Resource Group, which is 100% funded by activists. We bring you these calls in partnership with the Community Constituency COVID-19 Front, the Treatment Action Campaign, and UPA. These calls occur regularly and seek to bridge the divide between civil society and those who hold power and platform in the COVID-19 space. All of our recordings, along with the transcript and Q&A sessions, can be found at africanalliance.org.za. We encourage pre-submitted questions and welcome questions and comments on our social media channels. As this session is broadcast, we will do our best to answer all of them. So welcome, colleagues. Traditional health practitioners are a critical part of South Africa's public health response. In the context of COVID-19, their role, positioning, and importance is the subject of increased public discourse. In this episode of COVID-19 Conversations, we speak to Mr Solly Nduku, the Traditional Health Practitioner Sector Leader and Deputy Chairperson for the South African National AIDS Council Civil Society Forum. Mr Nduku has a wealth of experience in traditional health practices and works in various capacities, mainly in the public sector, in decision-making and strategic capacities. He has served as a member of the South African National AIDS Council Civil Society Forum, representing the African traditional health practitioners sector since 2009. He serves as an NEC member of the National Unitary Professional Association for African Traditional Health Practitioners in South Africa. Today, we find out more about how this essential sector is contributing to bringing one of the deadliest pandemics of our time under control and ensuring that community voices are, at every opportunity, centered and amplified. Mr. Solly Nduku, thank you so much for joining us for this COVID-19 conversation. You are very welcome, and we look forward to a rich and engaging discussion. I will hand over to you now to tell us a bit more about your work before we go into some of the specific questions. So welcome and thank you again.
Thank you very much, Tian and the crew. Very good evening, warm greetings during the time where people, they come from an Easter long weekend. And also some of the people, they are approaching the month of Ramadan. And I know that there are a number of festivities and celebrations that are held by different forms of religions and faith at this point in time. As alluded to already, that I'm a practicing traditional health practitioner who has been initiated as a diviner, that is Isangoma, in various forms. Initially, I was initiated as a diviner in the form of isiXhosa, okanye some they say it's Nguni, and I also got initiated in a semi-form of semi-Zulu way that is referred to as Umndigi Nomdao. And later on, I was initiated in a form of Ukuparula Umzau, under a Kobela Unoma, insizwa yakwaMpangela kwaMagwala ngempande yakwaMajoy yakwaMaseko yaphansi kwaZitha yakwaMaseko yakwaMthunzi Omuhle, and also later on did umzawo in isiTsonga ekwempande kaBaba, the late uBaba uChauke uSikhabela. So of course I've been also at a very young age not only involved in the practice as a practitioner, but also got involved as an activist, as I've always been involved in the struggles of the people, struggle for transformation, struggles for better life, struggles for change, struggles for transformation. And I have realized that my involvement in the struggle cannot be complete if it is not interwoven with the struggles for the total liberation of the indigenous and communities of culture, and ensuring that the knowledge and wealth that has been passed from generation to generation by our forebears, it gets a proper recognition and liberation and redress when need be, because our practice and our knowledge and our spirituality, it has been the epicenter of the oppression of an African in the African continent, because our African spirituality has been identified as a backbone and the main spine of the African strength. Then even the colonizers, when they approached our continent, their main target was to break that backbone, that is the spine, that being the African spirituality. So I continued to serve in various capacities, as alluded to, serving in the SANAC Civil Society space and the SANAC structures in general, and also being had the privilege of being appointed by the Minister of Health to serve in the Joint Ministerial Advisory Council for the Joint Ministers of Health and Minister of Social Development on social behavior change. I saw and regarded those as opportunities that humble me to serve more the people and contribute for the better society and a better world. Thank you very much.
Thank you so much for that. I think a rather powerful overview, especially setting the context of where we are now. Mr. Nduku, I'd like you to speak, if possible, about the traditional role or the historical role, rather, of traditional practitioners in what we now see as the mainstream public health sector. Is there a role, is there a place for traditional health practitioners in the mainstream public health sector? Do you feel that mainstreaming has happened adequately?
It becomes very important to remember that the evolution of the health provision globally, that even the biomedicine or the allopathic health medicine has been developed on traditional medicine during the 20th century. So which therefore that means that the existence of traditional forms of healing is forms that existed in as far back as our existence as human beings. But over time, I think traditional medicine has suffered, as I've already highlighted, the aspects that relate to the colonization and also the strength of the spirituality or the basis of traditional medicine on the spirituality, which made it being a target for those who looked and aimed at breaking the spine and the backbone of an African man. Then there was no way that they could not seek to demonize this holistic method of healing. But it's also important to understand in a broader context as to what is it that we're talking of when we talk of traditional medicine, especially in the African context, that we are talking of a holistic approach in the form of healing. We're talking of healing in terms of nature. We're still talking in terms of healing in terms of environment. We're talking in terms of healing in terms of spirituality, medicine, psycho, and social support. So that's the holistic approach that we're talking of. That's why that in the application of our practice, in the main, we are not encouraging where we consult a person as an individual, but we always encourage to consult a person as part of the family and a family as part of the broader society. Because we believe that in our practice, that when we do actually look at that holistic approach, would understand the contribution of a human species and to the nature, and the contribution of Mother Nature in the social and health and well-being of individuals. So in the African context, of course, South African context, basing on the Traditional Health Practitioners Act number 23, of 2007, which I would refer to for now, because this is one of the major milestones which has been actually achieved as we evolved to the struggles that have been passed from generation to generation, and which I, again, am humbled to have a privilege of being amongst those who have been part of the struggle prior the invention of the Act, but also not just to be part, but also to be part of the soldiers and as at an early age, who participated in ensuring that such a piece of legislation is delivered with its own limitations. But it has been a major milestone because during the dawn of our democracy, we had to bring out something which over the years we have identified that there are shortcomings in that act. But that act at least has set a primacy of recognizing at least some of the categories, about 4 categories of traditional health practitioners in our country, being the diviners, who are normally referred to as Izangoma, the second category being Izinyanga, that is herbalist. The third category being those that are referred to in terms of the act as traditional surgeons, but holistically in the African context, we are referring to those who are involved in the initiation of a boy and a girl child into adulthood or into manhood. The fourth category being the traditional birth attendants who are involved in the process of reproductive health. But there is another category which we have fought and struggled that it be recognized as well, the spiritual healers or faith healers. But because of the legislative processes, that category could not be inserted into the current legislation. But as a sector of traditional health practitioners and also the freedom fighters for recognition who are still pursuing that sector, it be incorporated, because I think there was a need to conduct an intense research, a work that should have been done by the interim council, which it has not managed to do up until its term expired, because part of the primary brief as per the parliament decision in terms of enacting the act was that the interim council will, amongst others, do an intensive research when it comes to this particular category, so that it can actually recommend to Parliament and to the amendment to the legislation if such a category can be incorporated. So when you are talking of traditional health practitioners and their role and the role in the healthcare delivery system, that's what we're talking of. But the importantly is that the role of traditional health practitioners in the public health is something that is not even a question that we should ask, because traditional health practitioners played and they are still playing, and they will remain playing that role, which is a critical role in the health delivery system of their communities at a primary level, not only at a primary healthcare level, but rather both in preventive, promotive, and curative aspects of health. Therefore, it becomes key that they work side by side together with other health practitioners, being the biomedic and allied health professionals in both aspects, that is in terms of preventive, promotive, and curative. But also, the recognition and mutual respect is something that needs to be further strengthened and promoted amongst these actually health providers. But also, that cannot be achieved only through dialogues, but there should be some form of formalization. In formalizing that, there are a number of pieces of legislation that need to be reviewed and repealed, like the National Health Act. It needs to be reviewed, because there are pieces of legislation in this country that we need also to recognize that they are a self-defeating to our cause, in the sense that whilst we are saying all these forms, or the 2 sides or the 3 sides of health delivery system must work together, must collaborate, but the other pieces of legislation, they even make it illegal for the two sides of practice to practice side by side. The biomedics are not allowed to actually, in terms of the legislation that exists, that they can have their own places of practice close by or within the proximity of allied health professionals or traditional health practitioners. So there's that process that we need to take it seriously as a country if we mean the real transformation and change, that we need to embark on a serious legislative reforms that will seek to render that the traditional health practices are actually developed, are actually promoted and advocated for, and the human rights are not hindered, because people, in terms of the Constitution and the Bill of Rights, they've got a right to health, but they still have a right to make choices on the nature and type and form of health service that they must get. But if you look in terms of the legislation that we have, in a way, that they actually silently seek to actually to dictate as to what people must choose if those pieces of legislations are not reviewed. So there is a need for a more holistic in health and human beings to ensure that we actually encourage that there should be a mutual recognition, there should be a referral system, not one-sided referral system where we say practitioners must refer people to hospitals and clinics, but there's a two-way referral system. But it's important to appreciate the good work that has been done thus far by a government, ensuring that practitioners, their part in terms of the legislation and policies of the clinic committees, they are part of hospital boards. But one of the things that we need to have also to look at as a sector is the capacitation of our own people so that they understand their role in those clinic committees and also those hospital boards, so that their role is just not about for actually ticking the box, signing register, actually adding to numbers, but they must understand that their role there is a product of transformation, and also their role is to ensure that they pursue transformation agenda in that process. And again, I just want to emphasize that if they go there as individuals, it's a problem. So accountability is key. Hence, it's important that the unity of the sector should not be a question of fallacy, because our sector cannot be liberated if people, they would want to be excited as individuals and serve in these platforms and take mandates from their pillows and report to their boards. So into their beds. It's important that, like any other profession, we are actually part of our own professional associations where we engage, deliberate over these issues, so that in whatever space that we get into, we carry a mandate of a collective. And where we lack a power, we go back and regain strength from the collective, which will make us to soldier on and move forward.
Thanks so much, Mr. Nduku. You've given us a lot to think about. I mean, one of the points that you raised was especially interesting to me when you spoke about accountability. You know, in the work, some of the work that we do at the Alliance, we try to unpack how decolonization of health happens across the world. And we are usually met with this response that, oh, but they have a seat at the table. And we usually ask to say, and then what? How does that seat at the table translate into, number one, meaningful input, knowledgeable input, and does it actually affect the decisions at the end of the day? So you've mentioned decolonization twice so far, and I've really wanted to just ask you about that. What do we need to do to decolonize the space? What is the top one thing, the top two strategic things that we as civil society need to do to accelerate the decolonization of the space?
I will just steal from the words of the struggle icon, Tata Madiba. I recall that at some point when he was addressing a rally in the Eastern Cape, in the then Transkei Mthatha Stadium, which was then referred to as Independence Stadium, a group of disillusioned people went to the stadium. They were carrying placards, and unapologetically, Tatu Madiba took the podium without seeking permission. And in his address, I quote, he said, please take down those placards. Go and organize yourselves. Formulate yourselves into civic movement, civic organizations, and come as an organized formation. We sit around the table and discuss and find solution together on your issues, close quote. And my point is that, you know, our sector of traditional health practitioners, I just want to state this, and I'm not ashamed of saying it. It's one of the sector which has been infiltrated by a high level of opportunism and greed. And again, that actually destructive force has permeated in a sector, our sector, in a various ways, because you would not find the sense to say a community that has been exploited by colonialism, by apartheid and all forms, you'll find that there are people who feel excited by being individuals, and they think that they can prosper and succeed if they are individuals. So again, that tells you that there is a high level of the colonization of the mind. We might be out of the colonial systems in terms of politics. We might be out of the apartheid system in terms of the political system, but in terms of the system of the mind, that is still deep in our minds. We think as individuals. I think about my own popularity. I think about being famous. If I can actually appear in every magazine, recognized as a great Inyanga, I think all is well. But that is meaningless because it can be destroyed within a day. What is important is that a sector of traditional practitioners should not be apologetic that they must have professional associations just like other professions. If you are talking of the our biomedical counterparts, in South Africa, they've got South African Medical Association, which is a major body for them. There is also another one. If you go to our counterparts, they've got the DINOSA, they've got the SANAC, South African Nursing Association. So that there, whatever they approach their struggles, they don't approach their struggles as individuals, they approach their struggles as a collective. But it does not end there. It also takes the narrative of development on how they develop their sector, how they preserve their sector, how they protect their sector, how they ensure that elements that seek to destroy the integrity of their sector is protected. So the biggest question there, everyone will say, traditional health practitioners, you are not united. Traditional health practitioners, how do you ensure that quacks and charlatans don't intrude your space? Certainly, we won't be bold enough to say if we're not actually organized. Hence, one call that I'm still making is to say, in our country, let us make sure that there are major professional associations. There might be multiple, but there must be major professional associations that seek to represent the voice of traditional practitioners so that when they engage whoever, they engage in that unison. Because all the efforts, SAPRA will exploit us. Pharmaceutical industries will exploit our knowledge and get rich out of our knowledge and will remain non-endings because we are divided. And I'm saying SAPS will work with individuals and those individuals will end nowhere because there is no united voice. As I'm saying, there will be a number of resources that are coming from science and innovation, actually going to SAPS, going to various bodies and universities. But when you look at the results, you must ask yourself, how many THPs that have got PhDs? Zero. So it is because this is other people who come and learn out of our knowledge and actually accrue credentials out of our knowledge. And at the end of the day, we clap hands, we are spectators. So this is the narrative that we say it must change. but we will not change it if we want to be individuals. Let us be united and talk in unison and pursue our struggle, that is decolonization of the mind that I'm talking of. Thank you.
Yeah, absolutely. And I mean, you know, what you are saying just really resonates. I mean, I think 18 years ago when I was a much younger activist, I remember sitting, I think it was a gathering of the traditional healers organization, then being guided by Pepsile Maseko and her father. And back then, even at those meetings, exactly what you're saying, I mean, I could almost copy and paste. Those were the issues to say, you know, we are not organized, the movement is weak, etc., etc., etc. And so I think it also mirrors broader civil society in terms of these struggles. But when you spoke about decolonization, it reminded me of a quote by a writer, Toni Morrison, who said, the very serious function of racism, or in this case, colonialization, is distraction. It keeps you from doing the work. It keeps you explaining over and over again your reason for being. Someone says you have no language, and then you spend 20 years proving that you do. Someone says your head is not shaped properly, so you have scientists working on the fact that it is. Somebody says you have no art or culture, so you have to work to bring that up. Somebody says you have no kingdom, so you bring that up. None of that is necessary. There will always be one more thing. So I think it's really powerful what you had raised. But you had also touched on issues of SAPRA and Department of Science and Innovation. And so I'm really interested in hearing your thoughts. You know, since we've been having these conversations, since the onset of the pandemic, we've had people from the DSI, we've had the MRC, we've had, to some degree, SAPRA. And one question we've constantly asked them is, what are you doing to ensure that traditional knowledge systems, traditional practice systems are centered, are focused on? In the early days, we had this huge focus on Umhlonyane, and it was almost rubbished in some cases to say, oh, you know, it's African traditional medicine, there's no clinical data, et cetera, et cetera. And so we've made a point of asking these questions to every single one of our guests. And so I really wanted to hear from you as an individual with your platform and with your power and with your position. What has your experience been like dealing with these entities that position themselves as custodians or platforms to amplify and share and encourage and nurture? My uneducated guess would be that they are all over you. They are constantly requesting to engage. They are offering you grants to develop, to meet, to strategize, to have think tanks, and to develop your own agendas with the support of these bodies. But I'll leave you to answer that question. How has your experience been, your relationship with these bodies? If we can focus on the two specifically, SAPRA and DSI, and perhaps MRC.
Yeah, Tian, to respond to that question, I'll pose a question that you might grapple with. And I just want our people out there to respond to this question, to say, how genuine is that relationship? And whom does that relationship seek to empower? Does that relationship seek to redress? And if yes, how far has it gone to redress? I will pose a very political question, because we should not play here holy cow, as if our exploitation and our oppression is separate from the holistic chapter of political discrimination and exploitation. Anyone who intended to contribute meaningfully in the liberation of South Africans, and I'm saying pre-1994, would that actually achieve that without engaging the African National Congress, without engaging the Pan-Africanist Congress of Azania, without engaging the AZAPO? And I'm saying I'm not going to answer, I'll just pose that question. If anyone had good and genuine intention of liberating South Africans would pursue a genuine cause of contributing to liberate South Africans without engaging those. And that's the point that I'm putting here, because there's a particular narrative that I want also to pursue. It is a common cause that in this country, when we like it or not, whether we want to undermine or recognize, there are formations of traditional health practitioners who have played a meaningful role and made a mark to be where we are in the struggles of recognizing traditional health practices, even the legislative reforms with their weaknesses. But the question is, has SAPRA had an engagement with those formations? From where I'm seated, I've never had any form of interaction with SAPRA. And I am saying, not as an individual, as a leader of a major professional association of traditional health practitioners in this country. In whatever platform, I've never had an engagement with SAPRA as well. And equally, has SABS considered to engage those bodies other than to call individuals and engage them in a boardroom? Has there been an engagement where it has been actually saying, as formations who lead this constituency, what is it that the agenda that you want us to pursue as mandated by the government? I'm referring to this because these are the entities that are financed by the taxpayers' money, by our government. They are entrusted with the responsibility of pursuing transformation. But again, would they pursue a transformation through reading from a paper written by somebody who learned about us without having engaged us in unison as a voice, as a mobile organized formation? And I'm saying that's what makes me actually have some serious reservations about what is happening in our country. I'm saying, if these institutions are genuine, why are they not engaging in a dialogue with us? I usually make a simple example. I'm not praising. I don't praise politicians, and I neither demonize them. But I always give credit where it deserves, and where there's no need to give credit, I will not. With the current Minister of Health, within a period of 6 months, first 6 months in office, we had an opportunity. I'm not saying everyone, but as leaders of major professional associations in this country, the NUUPAATHPSA and the THO, we had an opportunity for him listen to us and met to hear the position that we're carrying from our constituencies. Within a period of 6 months, he met with us not less than 4 times. And now, as opposed to his predecessor, who served 2 consecutive terms, who have not met us even a single day. And not that there were no efforts, there were efforts. Now, coming to the DTI, or Science and Innovation, that claim to be doing a lot in terms of seeking to promote, seeking to develop our indigenous knowledge and all those things. Unfortunately, we have not had the luxury of meeting that department. I'm not talking about the ministry, it's something else. I recall, because when I personally, as a leader, made an initiative to reach out to that department to say, we would love to have a meeting with the top echelon, I was told that we can only come when you have got your meeting somewhere around Pretoria. And I said, but you are government, we don't have resources. Can't you actually resource us to have a meeting with? They said, unfortunately, we're not. And all the meetings that I'm referring to with the Minister of Health, currently Dr. Zweli Mkhize, those meetings were resourced by his ministry to make sure. So when you talk redress, you talk actually the reparation and actually affirming those who were previously disadvantaged. We should not talk of fallacy. We should be genuine and be honest. That's why I say I do not actually praise, I don't give credit, but where credit it deserves, it must be given. We must recognize people have done good work and the departments have done good work. And those who want just to actually to make sure that they tick the box in terms of their APPs, they pursue a particular agenda. We should actually take into account that no, they are promoting an agenda, but that's not our agenda. They are promoting indigenous knowledge, they are promoting traditional medicine. But the question, for whose agenda? Because we have not had a dialogue with them, and they have not heard from us as the majority in terms of the organized practitioners of this country. We represent a majority of the voiceless in terms of the practice, so that we have not been heard by those bodies, just to understand, to say what our constituencies actually are looking for, what do they want, what form of development. If we're talking of product development, if we're talking of packaging, if we're talking of marketing, if we're talking of exporting our products, how do we ensure that it benefits our people? Unfortunately, so far, what we see this knowledge nicely moving and shifting. And I would say the dismay and the surprise that you will see, those who are academia and professors who are involved in this space, within no time, when they retire, they are going to have factories that will produce our products and market. So the biggest question will be to say, it will be those people who are sitting on the advisories, advising our government on this, and the question which you must actually answer. I said, I'm not going to answer and pose questions to you and the South Africans. Then at the end, whom did this seek to develop? Whom did this seek to redress? Whom did this seek to promote? Whom did this seek to make sure that the knowledge is preserved and protected? Thank you.
Oh, yeah. It's quite something to hear. I mean, certainly in our interactions, the response has almost been standard to say, we are looking into the plans. And you keep on wondering, okay, so I'm sure the plans are great, and I'm sure there's lots of promise in the plans. But what has been done to build that human interaction, that sense of solidarity? And I mean, I think throughout this conversation, one thing that has come through very clear is your passion for and belief in the power of the collective and movement. And it's so, in a way, it's tragic, because all of our struggles, whether HIV or GBV or whatever it is, have really gotten the progress they've gotten because of the power of movement. So it's really interesting to see how people almost invalidate that power of movements for individual prominence. But thank you for those reflections. They've really
maybe we expect too much even from the politicians, because even the most progressive politicians, even those who are probably communists, we might be expecting too much and forget that they are products of the colonial education. So maybe we expect that inherently, because they come from a certain school of ideology, we think that it will transform the education. But unfortunately, their masters in terms of education seem to have had a stronger power over their own ideological orientation. I'm not saying so, but that is possible.
Just putting it out there, Mr. Nduku, just putting it out there. Nova, thank you for that. I think as we reach the tail end of our discussion, in the context of COVID now, I really wanted to get your thoughts. You know, as the Ministerial Advisory Committee have been doing this, what they call stratification, placing different groups of people in different priority levels. What are your thoughts on traditional health practitioners being classified as essential workers, especially as we become, even though very slowly, we increasingly come to the point where our vaccination plan will roll out?
Yeah, certainly. I just have to make this disclaimer. I can't talk on behalf of the Ministerial Advisory Committee on Social Behavior Change, but I'll talk as an activist and as a practitioner. There is something that I just want also to put into the correct perspective, because there is a myth that has been created in this country that practitioners, they are against vaccination and all that forth. And again, we must actually, as I say, I'm talking here as a practitioner, and I'm talking as a seasoned practitioner. My first graduation was in September 1978. When I graduated, I was still young. When I first graduated in the first initiation as a Sangoma. So it's important that to put things into perspective, because traditional medicine, it is about the medicine, it is about culture, it's about spirituality, it's about custom, it's about knowledge. You acquire knowledge and it's about experience. So you don't think that you graduate tomorrow because you are possessed spiritually, you know everything. No, that's why we say our knowledge, it's a knowledge that moves from generation to generation. And over the years, I've been learning, and I'm still learning even today. Some of the people that I'm learning from, in terms of age, they're far younger than me, but I learn from them. So this is something that is important. If vaccination, we are the actual architects, practitioners of vaccination. Let me put it in our own Nguni languages. Who is talking of ukugoma? It is us, that's vaccination. Who is talking of ukuqinisa? It's us, it's vaccination. He is talking of ukuthintela. It is us, that is vaccination. So this clarification that we do, that is vaccine, because we are doing a vaccination against the spirits, against the various forms of disease. We even vaccinate people against lightning, which is actually sent by the evil people. So one thing that needs to be demystified is to say traditional health practitioner, because at times, you know, when you are called a dog, you tend to behave like a dog. You behave as if you've got a tail because it gets to your mind. Vaccination is our practice. But what has been the skepticism? The skepticism is based on the historic mistrust that has been between the Western, the biomedical and the African health traditional health practices. And there's been a limited space to share knowledge. So the very skepticism that you'll find on the other side about our forms of vaccination, it is the very same skepticism that tend to exist in terms of the perceptions and get perpetuated about the vaccine itself. But again, if you look from the generations that we're coming from, very few of us were not vaccinated. When we were at school, there's something that was called the anti, because we were vaccinated from polio. We were vaccinated from measles. And here we are still alive because we have been vaccinated. Our children, they are getting dual vaccination as Africans. They go to clinic for vaccination for polio. They go to traditional healer for vaccination against the evil. So the society, because more than 80%, according to the researches that have been conducted, our population, they actually still rely on traditional medicine. But they are not only relying on that, they rely also on both sides. So they take dual vaccination. Now, what becomes important? It's important in that in terms of COVID-19, what we have raised is what our people raised. They said, there is skepticism because we don't have enough knowledge about this vaccine. We need to be given knowledge, and we need to be empowered so that we can also continue to be the advocates for change and advocate for access and continue to be advocates for human rights as we have been doing. Because with the HIV and AIDS prevention methods, it was the same thing at the beginning. But once traditional health practitioners were brought into the fold, they were empowered, capacitated. They played a huge role as game changers. They played a huge role as advocates. They were able, within their own indumbas, to actually supply and give condoms to people. But what we're saying in terms of vaccine is to say, we cannot afford to have more lives lost. Many of our own have lost life. May their souls rest in peace. We have lost leaders. We have lost practitioners. And again, if then we're saying we are immune from death, we are immune from dying from COVID, we'll be misleading the society. But this, it means we must actually put our efforts together. We must collaborate, share knowledge. Hence, we initiated a session where we had an engagement with the South African Medical Association as the leadership of the sector and the two major associations in the country. We had a dialogue to say, how best can we have a platform where we exchange knowledge as practitioners now? So that things that we don't know, you share knowledge and empower us, and the things that you don't know, we do the same. So traditional health practitioners can play a meaningful role, as they already do, because after our engagement with the Department of Health and the Minister of Health, a program has been rolled out in provinces where our member practitioners are workshopped about the details on the vaccine, are providing answers to the specific questions that they were asking. The compatibility of the vaccine with the medicines that they are using, the compatibility of the vaccine with the chronic medication that they are taking, the compatibility and the side effects, if there are any, of the vaccine and the long term. So those workshops are starting to unbundle and answer those questions. And then that enables our practitioners to play the role that they should play in terms of the human rights, that they advocate, they encourage, and also they share knowledge to their clients. Of course, notwithstanding that people, they've got a right in terms of the Constitution, they've got a right to decide on the form of health service that they must take if they decide to vaccinate or not. But it's important that our people now, they are getting empowered and they have the knowledge. Hence, you have practitioners who have already got vaccine. And lastly, are we frontline workers or not? Inherently, we are frontline health workers. It is a formality for the pronouncement. I think our minister progressively said so, to say, so Lindu, we are asking something to say you should be, but you are health providers. You are not seeking permission from government. Our people consult you 24 hours. It's just a question of formality in terms of recognizing that you are frontline workers, because you are the closest to the people. You are those people who go for your services even at midnight. Even when a clinic closes during at night, the traditional health practitioner is always there. So we are frontline workers, but we must actually make sure that we are equal to the task and behave in that, and make sure that we protect and preserve our profession. Do not allow everyone to talk on behalf of our sector and misrepresent our profession, and even saying things that are really ridiculous, that we are ashamed of, because they demonstrate the level of lack of knowledge. So those are the things that we must actually embark on to make sure that we have got a peer education and peer engagement even amongst ourselves, and put things into a context. But when it comes to vaccine, we are the architects of vaccination. We vaccinate each and every day. We call people to come, sizobagcaba, sibaqinise, sibagome, ukuze bangashaywa impundulo, bangangenwa izifo, bangatholwa ukufa, bangashaywa lula ngamagciwane, because we've vaccinated them. That scarification is a vaccine in our own way. Thank you.
I love that. Architects of vaccination, much needed. Mr. Nduku, I've got one last question, which is really around South Africa's 5-year plan, roadmap that we work on every 5 years, the National Strategic Plan for HIV, TB and STIs. Really interested to see how it manifests in the next year in the context of COVID. As we are working together, the various sectors, the various writers, the technical people, to put together South Africa's next national strategic plan for HIV, TB, and STIs in the context of COVID. What is the role of traditional health practitioners in developing that plan? In the interest of transparency, I was one of the lead writers of the current NSP, and personally, myself and my team really did not see prominent agenda driving, if you can call it that, by the traditional health practitioner sector. What opportunities do you believe exist in this current process? And what are some challenges or some successes been historically in your sector's engagement with the National Strategic Plan?
Yeah, firstly, Tian, we need to give credit to the current leadership of SANAC, and also the leadership of SANAC during the past 7 years, and also the leadership of the SANAC Civil Society. You may recall that there is a point where we left SANAC in protest as traditional health practitioners and traditional leaders, because there was a point where we realized that SANAC has become a platform where there was not just a struggle for predominance, but there was a total domination of the biomedical researchers. Even the language and the jargon that was dominating. The discussions were not about what SANAC should have been, the agenda of mobilizing the society to rally behind the prevention, the development of NSP that is responsive. And having realized that even the leadership that was there was totally paralyzed, unable to rise to the occasion, we formally withdrew our participation as traditional health practitioners, and the traditional leaders followed us. And I think the transformation has emerged to an extent that our participation and the meaning and the understanding of the NSP is something that we can pride ourselves, because it finds relevance, and we find relevance in it. I will take you to specific goals. When it comes to specific goals, there are areas that you'll actually pick in terms of the NSP currently. In the NSP, we talk of advocacy for services. There's a talk of political will. There's a talk of human rights and redress of inequalities. And also the implementation that is aimed at ensuring that communities do receive decent services and their choices are respected, and their basic needs and support is in such a way that there is a referral system that is based on mutual recognition and mutual respect. Now, if you take from the very beginning of our interview, you'll still realize that these are the areas that you pick in the NSP in terms of goal 1. And then, if then these are the areas that are in the NSP, as traditional health practitioners, we should pride ourselves of this NSP and our contribution. What then should we be saying? We are saying, in moving forward, when we move to the new NSP, there is no need of substituting these goals, but there is a desirability to strengthen goal 1. But let's come to goal 2, because goal 1 talks of acceleration of prevention in order to reduce new infections. And then if you do that, you cannot do that with what I've already referred to, ensuring that within the context of human rights, where there's a political will, and there's also a political will, there's a political leadership. And goal 4, which talks of strengthening. When we talk of strengthening goal 4 talks of addressing social and structural drivers. When you're talking social and structural drivers, you are talking about certain aspects in terms of social behavior change and cultural barriers, which many times, even ourselves, as I say that, one of the things that actually amused me, but ashamed me, it's about 15 years ago, when actually I met in a public gathering. One of our forebears, a practitioner, very senior Sangoma, stood up and introduced himself, and he said, I'm witch doctor so-and-so. And I say, are we such actually brainwashed to an extent that I can stand up and say, I am Kefa so-and-so because I've been called a Kefa. So I'm saying, when we talk about these realities are not just fallacy, they are realities that we must deal with, which are very much painful. If our people were got to an extent of accepting that they are called Kefas and call themselves Kefas, because when one is actually calling himself a witch doctor, is equal to that. So these are some of the issues which we say we need to actually ensure that Goal 4 is strengthened, and as a sector, we are actually saying we have a role to play, because we need to play a meaningful role on social behavior change. We need to make sure that certain cultural barriers are eradicated, because some of the things are the things that don't belong to us. They were super associated with us and we accepted them. Like there are things that a violation of human rights, the violation of a girl child, this thing which is called ukutwala. I mean, the practice of ukutwala, ukuchacha, I can give you a lecture about that in terms of traditional communities. It had nothing to do with abduction. It had nothing to do with making our children to be sex slaves. And we must start to say, who has introduced this criminal element in this noble practice, which was meant to build actually coherent relations in a particular form? Because that approach was used for those families who could not afford in terms of resources. And there was a process where the partners were engaging and agreeing and the families were involved. But certain things, these are some of the things that we're talking of, the cultural barriers, the social behavior change, which in terms of the Goal 4 of the NSP is talking about. But we are saying that goal needs to be strengthened and also unpacked more, so that there is an understanding, so that it talks on certain things, so that people don't talk for us. When it comes to Goal 5 of the NSP, which talk of the implementation, that all the implementation that happens of the NSP, it must be done with a lens of human rights. And already, as I've already said, if then we are dictating as a country, we allow our donor partners to dictate the methodologies which actually violate the human rights, undermine human rights, is something that we say in terms of that goal must be strengthened, that the contribution and the support that is brought in by our donor partners in our country, it does have the lens of the human rights. It does not prescribe. People must have a right to make choices. They must make choices even in terms of the services that they need for prevention and promotion of their health. When it comes to Goal 6, which deals with promoting leadership and shared accountability, that's why we're there. We are there because we know that traditional health practitioners, they are not just part of practitioners, but they are part of a key epicenter of leadership in communities. There's something that is getting eroded, or some of the traditional leaders also who are apathetic, of themselves, who don't want to be traditional leaders, but don't want to associate themselves with the traditional practitioners. Unfortunately, history tells traditional leaders were advised by spiritual leaders who are traditional leaders. Their spiritual guidance on their society, on what to do and when to harvest and what not to harvest, and things that should not be done, because if they are done, there is going to be hate. If they do certain things in the society, there will be havoc and instability. So there's that kind of relationship which you cannot actually take away. That traditional health practitioners, they are part of the leadership of the society. They are power molders. They are having a huge influence, but also they are spiritual leaders. So if you recognize that in terms of the Goal 6, they play an important role in terms of that leadership. To make it simple, I know exactly. If my client comes to me and they say, you must not go to bed with your partner for 6 weeks because you're using this, I'm certain my client will not do that, will not go to bed. Because if I tell him that, you'll be able to win lotto, you said you want to win lotto, so don't go to bed with your partner in order to win lotto. They will do that. So again, if we recognize such kind of influence of our people, we must recognize that in terms of the NSP goals, they've got a role to provide in terms of the change, behavioral change, in terms of this breaking of the social barriers, recognition of the people, of the key populations in the community. Because we must understand that in terms of the goal 6, it's a goal that they can actually play, but also play a role in a continuous monitoring and evaluation in a manner that will ensure that the programs are delivered within the framework and the agreements that are reached in a more sustainable manner, so that we don't just have agreements just as for the sake of having them. We have an NSP for compliance. We must be able to say that NSP is carried to the latter. And lastly, I will actually talk of goal 8. Goal 8, which is about, we're saying the goal 6 need to be strengthened. Because goal 6 talks about the documentation of the best practices, capturing of the lessons learned, and the best methods of practice. You know, when I'm sitting here and I've got a very huge question, which is a cause for concern to me. During the time where involvement of traditional health practitioners was brought in, they were playing a huge role in their own numbers, in the prevention, a huge role. They were even trained as peers. They were peer trainers who were trained to train other practitioners on advocacy, on testing. And where did that program go? And if that was well documented and those lessons were kept, we should be somewhere in terms of the reduction of the spread in our country. And again, we have abandoned some. That's why I say, for me, I'm very much passionate about goal 8. And again, as a sector, we are of the view that we should actually be advocating for that goal to be more strengthened and a meaning be given to that goal. And I think those are the issues that are very much important to me. Of course, there are a number of thoughts that are around that people should be concerned to say, do we still have to be part of the SANAC family and play a role in the NSP? And my answer is simple, is to say yes, because we have got a role and we can feel that we are part of that family. And we are not just part of the numbers. We're making a meaningful contribution. I mean, the mere fact that we are talking now of a leader of THP sectors who has been elected by other sectors to be the Deputy Chairperson of the civil society. And I think that was not just, yes, I'm humbled by that responsibility, but also I'm humbled by that recognition given by the other sectors to our sector, that they see that we can actually, that sector can provide a role in the development and implementation of the NSP and leading in the process of such implementation.
Absolutely, thank you so much. Solly Nduku, I think we're coming to the end of our conversation. Is there anything else that you would like to say that we have not covered during this discussion?
My last words would be to say, a luta continua. The struggle continues, and there will be no total freedom without a freedom that is actually witnessed, and the freedom that is liberating our spirituality, liberating our indigenous knowledges. We don't become knowledge holders. We are recognized as knowledge owners, because a knowledge holder is somebody who holds knowledge on behalf of somebody else. You know, some of the things we just conform, but if you look at it, even the legislations and policies are designed by people who are outside our space, tactically and strategically, such that they put us on the sideline. Because one thing that I just want to put to you again, just look at this. Look at this. Indigenous knowledges were inherently in communities, but it is not everybody. I can make an example. Umhlonyane, everybody knows it, that umhlonyane works for flus, but the administration of umhlonyane and the measurements and the side effects, who knows it? It is the practitioners who know. Because our people were not hiding, were not cruel, were not hiding the knowledge from their communities. They made it that our communities know that for flus, you know, you use umhlonyane. But the house, it is the practitioners. That's why other people used umhlonyane and they had side effects. Because abuse and misuse of umhlonyane is dangerous for people who are pregnant. They run a risk of miscarrying. And abuse of umhlonyane and overuse of umhlonyane has got problem in kidneys. So who has that knowledge? It is the practitioner. So I am saying this approach, this narrative that is being pushed in our country of separating the medicine from the practitioner, it is against the orthodox of African traditional medicine. Traditional medicine, I prescribe, I administer, I diagnose, I do everything. It's unlike the biomedics where the pharmacist, I'm also a pharmacist. And this narrative, which is contrary to the ethics of our profession, our people they must look at it microscopically with a wide open eye. Like people now, they are not saying during the time of COVID, the traditional health practices made a meaningful contribution. No. They say skimming made a meaningful contribution. Because they just want to hide the truth that skimming is a form of practice of traditional health practitioners. Because there is this narrative which is done deliberately and neatly that you separate practitioners from their practice and take it away so that 25, 50 years to come, traditional medicine and traditional health practices. Traditional medicine will be there, but it will be something else conformed and transformed, but the traditional health practitioners will be part of history. And lastly, working together through promotion of mutual recognition, mutual respect in spirituality, in health, and the total well-being of not just the human beings, but the nature and society, nurturing our indigenous knowledges, our natural resources in a manner that sought to benefit and enrich our people through redress can genuinely build better communities, not a fallacy. I thank you very much.
Absolutely. Gosh, Solly Nduku, I can talk with you the whole day, but we live in a country with expensive data. So at some point we have to wrap it up. Colleagues, we spoke to Mr. Solly Nduku, who is the Traditional Health Practitioner Sector Leader and Deputy Chairperson for the South African National AIDS Council Civil Society Forum, having served as a member of the SANAC Civil Society Forum, representing the African Traditional Health Practitioner Sector since 2009. He serves as an NEC member of the National Unitary Professional Association for African Traditional Health Practitioners in South Africa. These conversations are brought to you by the African Alliance with support from the South African Medical Research Council and the Department of Science and Innovation and the Vaccine Advocacy Resource Group, which is 100% funded by activists. We bring you these calls in partnership with the Community Constituency COVID-19 Front, the People in Action Campaign, and UNIPA. Thank you for joining us. All of our recordings, along with the transcript and Q&A sessions, can be found at africanalliance.org.za. Mr. Solly Nduku, thank you so much for your time, for your solidarity, for your leadership, since as far back as anyone can remember, including 4 years before my birth when you graduated for the first time. So it's been such an honor and a privilege and a humbling experience to hear from you, to listen to your wisdom and your insights. And we value you and we salute your leadership and your dedication and your commitment. Thank you again on behalf of all of the partners and the African Alliance for joining us, and we wish you a good week further.
Thank you very much. I am quite humbled and honored, and I really appreciate, I enjoyed our conversation, and because you have said we can converse for more and more time. but time, unfortunately, time is money, money is gold, gold is a mineral. So we don't have control. It is only the capital that has got control over these commodities. We have to sell our sweat, sell our blood, and sell our energy in order for us to have this. Unfortunately, we are not in control. Right in the belly of capitalism, we still have to pursue this struggle for better source communities. Thank you very much. Very good.
Absolutely. Thank you so much. Have a good evening.
My pleasure.